America is finally coming to grips with its opioid crisis. Hi there, welcome back to Plain English. I'm Jeff, JR is the producer, and you are listening to episode 191 of Plain English, the best podcast for learning English. The video lesson for today's episode talks about how to use the word within to express time periods. And our flashcards are mostly about drugs. All those episode resources can be found on our website at plainenglish.com/191. Coming up today, the U.S. has been grappling with a crisis in both legal and illegal opioids since about 2012. Now, investigators are finally starting to target the culprits, and drug companies that aggressively pushed the prescription opioids are having their day in court. Plus, I have a really good phrasal verb for you, root out, and JR has his song of the week. Speaking of the song of the week, if you ever hear it on the podcast, but you can't look it up right away, maybe you're driving, that's totally fine. At least it is if you're on the email list. Every time we send out our Thursday updates, we also include the song of the week right there in the email. So if you're in the car and you want to add the song to your playlist, just check your email and the title and artist are all right there, courtesy of our producer, JR. To get those emails, just visit plainenglish.com/mail, M-A-I-L. It's something that's not frequently publicized internationally, but the U.S. has been facing a serious crisis with opioids. Opioids are drugs, both legal and illegal, that seek to reduce pain and mimic the pain-killing properties of opium, which is naturally occurring in poppy plants. The legal variety includes morphine, oxycodone, and hydrocodone. These are prescribed by doctors to patients who suffer from chronic pain. Chronic pain means non-stop pain. It's just something that doesn't go away. The illegal kind of opioids include heroin, fentanyl, and others. The number of overdoses has been on a terrifying increase since about 2012. About 20,000 people died of opioid overdoses in 2012, a worrying number that was increasing at a moderate rate each year. Within just 5 years, that had more than doubled to almost 50,000 overdoses a year. The equivalent of a small American city dies each year from this one type of drug. Opioids now represent well over half the drug overdoses in this country. To put that in perspective, more Americans die of opioid overdoses than from guns or car crashes, more than the AIDS epidemic killed at its peak, and almost as many every year as were lost in the entire Vietnam War. The deaths from overdoses are only part of the story. Many, many times more people struggle with opioid addictions and all that means for them. Financial ruin, lost jobs and careers, ill health, broken family relationships. Over 2 million people suffer from opioid-related disorders, and it tends to be the worst in rural areas and the Appalachian region. The states of Ohio, West Virginia, and New Hampshire have suffered the most. Opioids are extremely addictive drugs. Even when taking the legal variety, like morphine, patients have to be very careful not to take too much of it, not to take it too quickly, and not to stay on it too long. For doctors, there is always a balance between the desire to alleviate extreme or chronic pain on the one hand, and the ethical imperative to make sure patients take a responsible amount of drugs on the other. For patients, especially those suffering from chronic pain, following the limits and guidelines of their doctors can seem unbearable. Too often, in search of relief, they look to find other doctors willing to prescribe them more, sometimes multiple doctors at a time. And there were all too many unethical doctors willing to prescribe opioids irresponsibly. Pain relief clinics opened up, essentially selling opioid prescriptions with few protections or safeguards. They just wanted the money, oftentimes in cash. And the makers of these drugs pushed them on doctors, touting their benefits, but not fully explaining the risks of addiction and overdose. For years, the number of prescriptions increased alarmingly as patients chased more and more pain relief. The drug makers insisted there was less than a 1% chance of addiction, even as the number of prescriptions rose and rose to an implausible level. Patients were chasing more prescriptions than were safe. The drug makers were all too happy to continue selling higher quantities of their drugs, and unethical doctors and clinics filled prescriptions with abandon. At the peak, Americans were getting 4 times as many opioid prescriptions per person than Europeans were. The U.S. government was caught flat-footed as the crisis raged in the last several years. Now, however, there is wide recognition that the issue is a public health emergency, and there is, at last, a national consensus that the issue needs to be addressed at the highest levels. State governments and the national government are targeting both drug makers and the irresponsible doctors. Purdue Pharma, the maker of OxyContin, was the most high-profile opioid maker. It is being sued by thousands of local government entities for its role in the opioid crisis. It is likely to declare bankruptcy and turn itself into a nonprofit, donating all proceeds of future sales to a public trust. Other drug makers, including some household names like Johnson & Johnson, are also being targeted in court. Doctors themselves are not escaping notice. The U.S. government is using advanced data analytics to root out clinics that were overprescribing drugs. They found one location that consulted with a patient for 91 seconds before dispensing hydrocodone, for cash, of course. The investigators say there's little difference between some of these clinics and drug dealers on the street. I feel so bad for the people caught up in this. This isn't true in every case, but in so many cases you read about, it only took one injury or surgery or illness for someone to get prescribed OxyContin or Percocet or something. And then these pills are sitting right there in the bottle. The pain is worse than normal one day. One thing leads to another, and the person has taken more pills than prescribed. Then they have to go to another doctor to get a new prescription, or they'll be left short when the first one runs out. And that's it. And that is all it takes to get addicted. Those are powerful drugs, and it can be a really, really painful spiral down after that. It's just really sad how many people have been affected. I heard from several listeners that I'd like to say hi to. First of all, this is incredible. Jagoda from Poland got back from an epic trip of a lifetime, and after having traveled to so many places, she wanted to brush up on her English. Listen to what she did. She and her boyfriend rode their motorcycles from Poland, where they live, to Nepal, 30,000 kilometers distance, camping the whole way. They went through Georgia, Pakistan, India, Iran, Tajikistan, not in that order, obviously. I'm pretty sure I couldn't put the countries from Poland to Nepal in the correct order, much less plan a route from one end to the other. Jagoda sent me some pictures, and it looked amazing. And let me just say, she is brave. Anyway, she's back home in Poland, and after traveling so much, she wanted to improve at English, so she's been with us for about 8 months. So welcome to Jagoda. I also want to say hi to Peggy from Hong Kong and Yvonne and Stephanie, both from Bogota, Colombia. This is a good phrasal verb today, to root out. What does it mean to root something out? It means, fairly simply, to find something bad and remove it. Usually, that something is hidden from view. The root is the part of a plant that goes all the way down into the earth, into the soil. So if you have weeds in your garden or other plants you want to get rid of, you need to dig deep and pull them up by the roots. Just cutting off the part you see won't be enough. You need to dig in to get to the roots and pull them out. That is the image I want you to have when you think about this phrasal verb, root out. To find something bad and remove it, but remember that image. So here's how you heard it right at the end of the episode. The U.S. government is using data analytics to root out clinics that were overprescribing drugs. The investigators are using analytics to find the bad clinics and then remove them. So this is a great example of root out. If they just waited for complaints to come in, and if they only investigated the clinics that were the subject of complaints, like the most obvious ones, then they wouldn't be rooting anything out. That would be just like cutting out the visible part of a weed or an unwanted plant. Instead, they're analyzing big data sets to see which doctors are prescribing much more than average. How many prescriptions are being issued per patient or per visit? if there are areas in which the same patient gets prescriptions from multiple doctors. I'm sure they're looking at many more things than that, but you get the idea. Only by digging deeper, really searching, really investigating, can they root out the problem. Otherwise, they would just be dealing with it on the surface. A very common way to use root out is with the word corruption. Corruption is like dishonest or illegal behavior, especially by powerful people. A new mayor may take office and declare he or she wants to root out corruption in city government. I was looking for a good example of root out online, and sadly I came across a pretty good one. The ex-administrator of FIFA pledged to root out any wrongdoing in the International Football Association. Of course, that ex-administrator is now under investigation himself and is banned from football. So far from rooting out the problem, he was part of it. In episode 140, we talked about a huge cheating scandal in American university admissions. Government investigators and now prosecutors are trying to root out the culture of cheating in college admissions. You can root out corruption, root out cheating, root out illegal activity, root out a bad culture. You can use root out with something intangible, like that, something you can't touch. You can also root out tangible things like illegal doctors. Authorities in Mexico are trying to root out the police that aided El Chapo for so many years. That's another example. Okay, the song of the week is Gone, Gone, Gone by Philip Phillips. It's an upbeat song, rather easy to understand, I think. Philip Phillips won the 11th season of American Idol and has sung the national anthem at American sporting events, including the World Series back in 2012. So the song of the week is Gone, Gone, Gone by Philip Phillips. If that's not on your Spotify or Deezer playlist, check it out today. And thanks to JR for the nomination. That's all for today. Thanks as always for being with us. JR and I will be back on Monday. If you've enjoyed today's episode, then I think you'll love Plain English Plus. It's our new membership program that's just for people who are serious about improving their listening, speaking, and writing. Members have exclusive access to video lessons, members-only flashcards on Quizlet, online courses, and our famous transcript translations into 7 languages, no less. Everything you need to know is available at plainenglish.com/plus. Come learn why so many of your fellow Plain English listeners have already signed up to take their English to the next level. plainenglish.com/plus. See you Monday.